A treatment with a clear aligner system, such as Invisalign, will only be effective if the aligners are worn all the time. And I think most people know this. But what a lot of people don't know is there are two things that really contribute to the aligner being comfortable enough to wear throughout the day in meetings and presentations and such. And here's what they are. So first, the aligners are fabricated based on a digital progression called a ClinCheck. Now, if a doctor is not experienced with Invisalign, the movements may not be realistic. They may happen too fast or not at the right sequence. When that happens, the aligner will get out ahead of the tooth movements and start not to fit as well. And this happens very gradually. So in other words, each aligner is supposed to move the teeth a very small amount, and all of them are supposed to fit perfectly. But if the plan was not constructed properly with experience and expertise, then the aligners will start to slowly not fit as well. And when that happens, the patient becomes more cognizant of the aligner, even subconsciously. They just won't feel like they can wear it, and they take it out for meetings. And then when that happens, the movements will happen even less predictably, and you get this sort of downward cycle. That's one aspect. And here's the other aspect. When patients first get the aligners, a lot of people don't immerse themselves in it as they should, where they're wearing it more so at night because they find it's weird, they're not used to it. And then what can happen is they'll go to the second aligner without really having worn the first enough. And guess what? The second aligner will fit perfectly. So they think. And then they think, you know what? I don't know what Dr. Goodman said. This is fitting fine. And they will then go down a path where they're never wearing the aligners enough. They never feel like they can. They never really get used to it. And then the movements will not happen. So when you get aligners, you must invest that first few days, week in wearing them all the time. And yes, it might feel funny, but your speech will not be a problem and you'll be comfortable with your aligners. They won't hurt. Some people call me up and say, Dr. Goodman, I'm doing good with the aligners. I wear them all the time, but I'm concerned because I don't feel any pain and my friend said it's supposed to hurt. It's not supposed to hurt. The friends whose aligners were hurting were the ones who were not wearing them enough or who had a dentist that didn't plan it out properly. So you got to get your aligners from the start and wear them well, and then you'll be good to go.